Thank you so much for staying with us right here on Women Radio WFM 91.7. Hope your day is going on well. My name is Rose Yusuf Kaiser. This is Nigeria's first radio station for women and their families. And of course, today is our day 2 on the 16 days of activism. Yes, 16 days of activism started off yesterday, and we are bringing on different organizations to come talk to us about rising above SGBV. Today is already day 2, so for the next 14 days, we'll also be having organizations come through each day, including weekend, till we get to the 10th of December. So yes, I welcome you to the 16 Days of Activism, Day 2 on Women Radio WFM 91.7 FM. The 16 Days of Activism is a specialized program where we get to raise awareness, mobilize action, and call for the prevention and elimination of all forms of violence against women and girls worldwide. Now, this broadcast started yesterday, Monday, 25th November 2024, and is going to run through to 10th of December 2024. All right, at 12:05 p.m. So you can do what to join the conversations by contributing or reacting to this program by calling us on 07000 917 917. Send us a WhatsApp message on 070 317 56537. Our social media platforms are there too. You can send your contributions: Facebook, Instagram, X, and of course YouTube at WFM917.com. Log on to our website www.wfm917.com and get to listen live from any part of the world. All right, so today on the day 2 of the 16 Days of Activism, we'll be discussing work done so far, challenges, way forward in supporting survivors of sexual and gender-based violence. And of course, that's why our topic is rising above SGBV. So today on the program, we have a representative from Tabitha Empowerment Center. All right, Tabitha Empowerment Center, and we have the advocacy officer with us, Gladys Emmanuel Esquire. I wish you could see her face. The picture that I saw of her, she looks young, and I was just so excited that she's doing. She's representing this organization who is doing well in terms of cases of SGBV and so on. So yes, we're going to be hearing a lot of the things that they have done as an organization. So once again, this is Women Radio WFM 91.7, and of course my name is Rose Yusuf Kaister. So don't forget, you can be a part of the program by dialing 07000 917 917. Send us a WhatsApp message 070 317 56537. All right, so let's go ahead and get to meet Gladys Emmanuel. Hi, Gladys.
Rose, how do you do?
I'm doing well. And how have you been? How is 16 Days of Activism starting up?
Currently in a community in Abuja, Peggy community to be precise. We just finished off the community stakeholders engagement. Wow. And trust me, it was mind-blowing.
I can imagine. I can just imagine. We're definitely going to hear more about that. All right, now, the theme for this year is No Excuse, Unite to End and Prevent Violence Against Women and Girls. All right, so that's the theme for the 16 Days of Activism. Now, violence against women and girls is one of the most widespread human rights violations globally. According to United Nations Women, nearly 1 in 3 women have experienced physical and or sexual violence, whether by an intimate partner or others, at least once in their lifetime. In 2023 alone, just last year, over 51,100 women were murdered by partners or family members, equating to 1 woman killed every 10 minutes. Now that's serious. This violence, which can be physical, sexual, or emotional, has severe short and long-term effect on women's physical and mental health. The scale of this crisis underscores the urgent need for comprehensive action to prevent violence, support survivors, and ultimately end these violations. All right, so it's a time where we get to raise awareness, we get to mobilize action, and call for the prevention and elimination of all forms of violence against women and girls all over the world. All right, so let's go ahead and get to hear more from Gladys Emmanuel. Like I said, she's an advocacy officer with Tabitha Empowerment Center. So, Gladys, now as an organization, you just told us some of the activities that you have lined up. You just spoke about one of it. Now, let's even hear how you get to support survivors of SGBV. More specific programs or services does Tabitha Empowerment Center get to do to help survivors rebuild their lives after experiencing SGBV? Because for us, Women Radio, for this year, we are trying to concentrate on the survivors of SGBV. So let's hear.
Thank you very much, Rose, for that question. So as an organization that was established since 2017 with a core mandate to eliminating domestic violence, the number one way or specific service we provide for survivors of SGBV is psychosocial support. We cannot overemphasize the importance of psychosocial support. So we do this leveraging the presence of our in-house therapists, and sometimes we do individual counseling sessions. Other times we undertake group counseling sessions. And in fact, for the 16 days of activism, we understand how important this is. As such, at one of our target communities, we would be providing psychosocial support, leveraging a support group and the presence of our in-house therapists. So we'll be leveraging the presence of our in-house therapists to be able to accomplish this. Another thing we also do as an organization is the provision of legal aid. Now, when issues of SGBV, sexual and gender-based violence, comes to our center, we need to dissect the issues. For people out there, it's just an SGBV case. But for us in the space, we know that these cases have the medical angle, there is the legal standpoint, there is also the part for psychosocial support, and there is perhaps the part for referral service. So what we also do is, with partnership with organizations such as International Federation of Women Lawyers, whether the branch in Abuja or the branch in Plateau State, where we have a volunteering unit, or the branch in Kaduna State, we are able to provide pro bono legal representation. So pro bono means free of charge, at no cost at all. We are able to provide this, and equally we leverage partnership with Legal Aid Council. Sometimes when these cases are overwhelming, we are able to refer clients and just guide them through the process to these various partners. And also we look at life after, access to justice, access to psychosocial support. Some of these cases emanated from a standpoint of this person did not have financial wherewithal. As such, she had to stay with a relative or stay with someone who preyed on this situation and took advantage of them. So one thing we look at Tabitha is through our Empower Her initiative, which is an initiative we flagged off in 2022 with support from AIDS Healthcare Foundation. We were able to start off vocational training and skill development. So we do this both for widows, for survivors of GBV, and other vulnerable women. What we do is we provide them with skills such as financial literacy skills. With these skills, they are now able to build on it, and then we disburse seed capital for them to start off businesses. That way they become financially independent and they are not subject to any form of exploitation. Then we look at the educational bit of it. We know that most of these survivors, sometimes they have not gone through school, and as such, we're able to provide access to education. And we've been really, we're so grateful to some of the donations that have come in, and even some of the fundings that have come in to be able to facilitate this cause. So through the Empower Her initiative, again, we're able to provide scholarships sometimes for 1 year, for 2 terms, depending, and we're also able to provide scholastic materials for vulnerable children and even survivors themselves. Then finally, we have a structure known as the Anti-Gender-Based Violence Community Champions. These are persons that have been trained by Tabitha Empowerment Center, and they are present in about 5 communities in the FCT. So with these particular persons on ground, they are able to provide grassroots support, whether it's interim support to survivors of SGBV, and then they've been properly trained on how to facilitate referral or escalate these cases to the appropriate quarters.
Wow. Oh my goodness. This is quite a good number of things that Tabitha Empowerment Center is actually doing to support survivors, and not just survivors of SGBV. You also mentioned widows, and that is an important group of people that sometimes we don't even tend to concentrate on as a society, except we get to hear one or two things. So yes, well done. This is definitely doing a lot in the community where you are. So now let's look at societal stigmas. Now, how do you work to address societal stigmas, cultural barriers that could discourage survivors from seeking help? Because that's one thing that we get to see happen very often in our societies. So how do we get to do this, especially in, around the communities where you get to have all of this, where you get to give out, a lot of the help or the support that the survivors need?
All right. So like I mentioned earlier, this morning we just concluded a sensitization and dialogue with stakeholders at PEGI community in the FCT. So one of the ways we are able to address societal stigmas, and through this dialogue, actually, we heard lots of things. We heard from the cabinet members of the traditional ruler. We heard from the local vigilante. We heard from the chief imam and chief pastor. We heard from parents. We heard from youths also. So it was a lot of perspectives to these issues and how we can adequately tackle it. So for us at Tabitha Empowerment Center, one thing we leverage on is community sensitization programs. We create awareness at any space available. In fact, we create awareness at schools, at markets, at bus stations, even at churches. During the 16 days of activism, there is a community who would be visiting one of their churches, because that is where we get the large number of people, and then we are able to provide them with all of this information, including information around dismantling cultural barriers and ridding the community of stigma, because that is one of the reasons why persons are not able to come forward and report cases of SGBV because of societal stigma. Also, we train community champions. Now, amazingly, our community champions are made up of more men than we have women. The reason is this: we have understood over time that it's important to get the male folks towards tackling issues of sexual and gender-based violence. So we've been able to secure male allyship and train them as community champions. Thereby, they are able to also effectively disseminate anti-SGBV messages and provide support for survivors locally. So we have them present in Jukoi and Gwangede, Pegi, Gida, Mangro, and Dafar community. Amazingly, there is one community that is all manned by an all-female cohort. So we have from the oldest to the youngest girl or youngest woman in that community being a member of our community champions.
Wow.
And they've been doing amazingly well. Then, of course, we undertake advocacy initiatives, which is where we engage traditional rulers, the law enforcement in dialogues to challenge harmful norms and even some of these gender stereotypes that fuel stigmatization.
Wow. All right. Thank you very much, Gladys, for taking us through, how Tabitha Empowerment Center gets to address societal stigmas. And yes, I would say kudos to you, because when you bring together men in the society, you bring together young boys, they would actually help you achieve a lot of this, because they are the heads of the home. So if we're able to have them, if we're able to raise the awareness among them, I think it would be better spread down. And at the end of the day, that will go a long way in preventing SGBV. And when we prevent SGBV, then we'll not even be talking about survivors of SGBV in the first place. So yes, well done to Tabitha Empowerment Center. If you're just joining us, this is Women Radio WFM 91.7, Nigeria's first radio station for women and their families. And of course, this is 90 minutes after 12. My name is Rose Yusuf Kaiser, and today is our day 2 on the 16 days of activism. All right, and with me this afternoon talking about rising above SGBV is Gladys Emmanuel Esquire. She's the advocacy officer of Tabitha Empowerment Center, Tech. All right, so we'll just go ahead and continue with the conversations. But if you to be a part of the conversation, you can do well to dial 07000 917 917. Send us a WhatsApp message on 070 317 56537. All right, Gladys. Now, we've talked about how to curb, or rather how Tabitha Empowerment Center has been able to curb societal stigmas, cultural barriers, that discourage survivors from seeking help. Now, let's look at how your organization has been involved in communities, in different communities. Now, I've been hearing you mentioning Abuja and all of that, and even collaborating with other organizations in some other states. Now, how does Tabitha Empowerment Center involve communities in raising awareness and fostering a culture of zero tolerance for SGBV? Now, you've also mentioned that, you have champions in different communities who have actually helped to push, this agenda down. So let's look at how different communities have responded to this. How has Tabitha Empowerment Center been able to involve all of the communities that you work with, and what's been the results so far, in fostering the culture of zero tolerance for SGBV?
All right, thank you very much. So I would not say that all communities have accepted this message with open arms. Sometimes we have faced pushback, but again, it gives us the room to strategize. It gives us the room to collaborate more and seek out more strategies to be able to meet each and every community, regardless of how dynamic they are. So one thing that we do is we organize public events. So last year, there's this particular, in fact, there are these communities, 2 of them, that we work with. They're neighboring communities, but that is where we get more cases being reported of SGBV. And as such, what we decided to do is we decided to organize a program that will attract mostly the male folks, because the women are the ones who are the victims or survivors. And as such, we cannot be telling them, oh, you need to prevent this. How about we address the major characters now in this scenario, which most times perpetrators are the male. So we organized this event known as our anti-gender-based violence football match. Everybody loves football. Football unites, football brings people together, and in fact, we forget our numerous differences once football is involved. And as such, that was one of the largest events we've ever organized, because we had over 400 plus show up. We even had traditional rulers, ethnic leaders who honored this particular invitation and stayed till the end of the football match, just to be sure which of the communities was taking home the trophy. But beyond the football, it was the strategy to attract the people and then disseminate the message. So what we did was we collaborated with the National Agency for the Prohibition of Trafficking in Persons, NAPTIP. We equally collaborated with various partnering civil society organizations, including the International Federation for Women Lawyers, FIDA Abuja. We got them together and we started off the football match with sensitization. After the sensitization, then came the football competition. And after the competition, whatever trophies or whatever medals or certificates they were receiving demonstrated that this was a contribution they have made or a commitment they have made towards ensuring they rid their communities of sexual and gender-based violence. So for us, we adopt the use of public events. We equally undertake what is known as school drives. Currently, we have a part of our team who are in some schools disseminating information. Through the school drives, we are able to set up what is known as school clubs. Now, these school clubs have, on an average, over 20 students per school. And we've been able to internally develop curriculums that speak to issues around consent, speak to issues around human rights, the legislations that we have, and how we can collectively address sexual and gender-based violence. Importantly, we also ensure that the teachers are the ones who man the school club. That way the school gets very involved and they don't see the school club as an alien structure, but they see it as one that they should get committed to. Then, of course, I've mentioned the use of our community champions, and then we hold dialogue sessions. We cannot have more than enough. There's nothing like more than enough dialogues. There's a need for us to always hold those town hall meetings. There's a need for us to always hear from this community. There's a need for us to always pay those advocacy visits and secure the buy-in of traditional gatekeepers. That way they are able to commit towards this cause and create or ensure safer communities for themselves and, of course, for the inhabitants.
Okay. All right. Thank you very much. Those are definitely amazing programs that we get to involve communities, community heads, and different, stakeholders in the community, bringing them together so that, we can actually push down the agenda of, taking away SGBV totally from our societies. All right, Gladys, now let's look at challenges, because I know all of this that you've mentioned, all of these programs, all of these initiatives that you've mentioned, would definitely come with its own challenge. If it's not a challenge of people accepting, it's a challenge of, making sure that these survivors don't go back to, where they have been abused, and all of it. So, yeah, I can just imagine the kind of challenges that you get to face in your effort to, prevent SGBV or even to support survivors. So let's talk about the challenges you face in your efforts to support survivors. And how do you think that other stakeholders can come together to help address these challenges? Because for Tabita Empowerment Center, your challenges could be peculiar to your communities or to the places you get to visit or try to reel out these initiatives and programs that you do. Now, but that notwithstanding, it could also be similar to other organizations in different communities too. So let us hear some of the challenges that you faced and how you've been able to overcome some of these challenges.
All right. So for us, some of the major challenges that we face is one, limited awareness amongst community leaders and gatekeepers. We did an on-the-spot survey today in a hall of over 50 persons from a community. We mentioned how many of you are aware of issues around violence against women and girls, or how many of you even know that violence against women and girls is a global pandemic. I was surprised to see less than 10 hands up.
Wow, are you serious?
Yes, this includes members of the cabinet. So when there are limited awareness like this, abuse sometimes is inevitable. Perhaps that is the best way they know how to approach the issue. Maybe you call the perpetrator and the victim, you listen to both of them and say, don't do it again, and then you let the perpetrator go. That emboldens the perpetrator to go on and continue the abuse. So one thing we always do to try and fill in this gap is public education or campaigns that are targeted at providing insight. Not only insight to community members, but also insight to the gatekeepers, because these people are the custodians of the norms and traditions of that particular community. Then, of course, we have funding. Funding is a major issue for not only Tabita. I'm sure all CSOs sing the same song when it comes to funding. Insufficient funding is a challenge. But one of the ways we're able to surpass this is getting donations. But again, we'll be appealing for increased funding and resource support, both from the government and also from the donors. Issues of social justice is one that requires specific and strategic budgetary allocation. So this is an opportunity for us we are appealing to the conscience of the government to look into more allocations, especially resources and funding. Then we have Stockholm Syndrome. You mentioned something in your introduction. You said survivors going back to their abusers. Yes, it happens all the time. In fact, this is one of the major ones that we are facing. Someone comes in to report a case, you start working on the case, and in less than 2 weeks, they come back to you stating they want to withdraw. My pastor has waded in, my family has waded in, my community says I shouldn't go further. It says we should try and amend our homes. And before you know, they withdraw this case. And the interesting thing with cases of SGBVs, you can't really force someone to go on with the process.
Yes.
Especially definitely. If it's not a child that is involved. If it's a child that is involved, we know that the state takes into consideration the best interest of the child. So Stockholm Syndrome is something that we get to deal with all the time, but with more awareness, with more reassurance, again, that they will not be attacked either by the perpetrator and they will not be stigmatized. We have gradually been able to address this. Then we have reluctance from some key stakeholders. It's quite unfortunate that some major stakeholders that are supposed to be addressing these issues have shown some form of reluctance or dismissive attitude when it comes to this particular issue. But again, this boils down to more synergy, it boils down to more awareness. Then we have security challenges. As it stands, there are very little provisions in this country for the safety of human rights defenders. And as such, this leaves us very vulnerable because at the end of the day, we are coming for a perpetrator who has done, sometimes these perpetrators are the high and mighty. One phone call and a lot of things happen. So sometimes human rights defenders are subjected or they are at the mercy of these perpetrators. But one way we've been able to address this is through the collaboration with organizations such as NAPTIP, such as FIDA, and we've been able to carefully go through this, especially securing the buy-in of community gatekeepers, because then we get the endorsement of the traditional ruler and we are able to go ahead with what we set out to achieve. So in a nutshell, this is some of the challenges and some of the ways we've been able to overcome these challenges.
All right. Thank you, Gladys. Now, as we wrap up the program for today, let's talk about some of the stakeholders that you have, mentioned, having less interest in such issues or just withdrawing back or not just feeling interested in some of these issues because at the end of the day, that's not their focus. Now, how do you think stakeholders such as society, government, and other organizations can come together to support survivors of SGBV? And then you give us your final words with that too.
So one thing is, I always say it over and over, issues of social justice, issues of SGBV cannot be resolved in silos. There is a need for synergy, there is a need for collaboration. Now, based on these various stakeholders or persons of interest now, whether it's the society, the government, or other organizations. For the society, there is a need to collectively challenge stigma and provide community-level support for survivors. So it behoves on the society to be able to come up with strategies not only to punish the perpetrator, but we need to also avert our minds to aftercare for the victim. Sometimes we are all concerned with access to justice, access to medical care, and after that, what happens? What is left of the victim? So society has a huge role to play because then they are able to properly support the victim or survivor, whether it's from the family standpoint or even maybe the survivor is a member of a school or the member of a church. That mere reassurance that everything will be okay and there's someone to always lean on during the healing process will go a long way. And then on the part of the government, I cannot stress this enough, there is a need for more enforcement and implementation of our anti-gender-based violence laws. Take, for instance, the Violence Against Persons Prohibition Act. Even take into consideration the Child Rights Act. There is a need for more enforcement, more implementation. If we are able to effectively implement our Child Rights Act, we will not be having issues such as child marriage. We will not be having issues such as defilement of a child. If we are able to effectively implement the VAP perpetrators of any form of violence, whether it's sexual violence, whether it's physical violence, female genital mutilation, economic deprivation, human trafficking, they would be punished, and this will serve as a deterrent to other persons who might want to embark on this. Then for the organizations, we need to collaborate. There is a need to collaborate to be able to ensure that we are able to provide proper awareness now for these various communities or designated communities that we reach out to. We also need to collaborate to pull resources together to further this cause. And there's a need to collaborate for comprehensive care system. Now, one thing that is lacking, which I think is going to be addressed during the 16 days of activism, is the presence of an effective referral pathway. We need to come to a point in this country where we know that if a case maybe comes to Tabitha, there is an effective referral pathway. We know that, yes, once it comes to access to justice, we divert it to NAPTIP. If it's psychosocial support, I could quickly refer to Cheche Yara, Child and Advocacy Center, or if it comes to ADR, Alternative Dispute Resolution, I could refer to FIDA and other partners of that sort. So we need to also develop a workable referral pathways. Then in closing, it's important for us to note that issues of sexual and gender-based violence are gross human rights violation, and they go against every tenet or every principle that human rights stands to achieve. And so as a people, we must put our hands together to bring an end to this menace. Thank you very much.
Thank you. Thank you so much, Gladys, for being a part of the program and talking to us about Tabitha Empowerment Center. And I must say, well done to all the programs, all the initiative that you do in the different communities around where the organization is and even beyond that. So well done to Tabitha Empowerment Center. And thank you too for being a part of our 16 Days of Activism campaign.
Thank you. Thank you so much. It was a pleasure.
All right. Do want to have a great day ahead and all the best in all the programs you have for the 16 Days of Activism.
All right. Thank you so much, Rose. Thank you.
All right. So that's it. You heard it from our organization for the day 2 of our 16 Days of Activism campaign right here on Women Radio, WFM 91.7. A very special thanks to our guest today, Gladys Emmanuel, Esquire, Advocacy Officer, Tabitha Empowerment Center Tech, and thanks to the program's team of Women Radio for putting this together. And of course, the executive producer, Tomo Okewa Lishonaya. My name is Rose Yusuf Kaiter. Tomorrow, we'll be here at 12:05 with another organization to talk about Rising Above SGBV. I'm talking about empowerment of survivors of gender-based violence for the 16 Days of Activism. Do want to stay with us right here on Women Radio, WFM 91.7.
WFM 91.7.